Hi, my name is Nicole, and I've been here at Madison Medical as a patient for 8 months. What brings me in here today is for my weekly shot of Tirzepatide, which is helping me with my weight management and my diabetes. I was diagnosed with type 1 diabetes in 2013. I was really thirsty. I kept using the bathroom. So I finally went to the emergency room and found out that my blood sugar was 600, which a typical normal blood sugar should be about 130. What brought me here is I heard a lot of good things about Madison Medical after doing research. I heard good things about the Tirzepatide injection, so I just decided to take a chance and come here. I do consider Tirzepatide to be a big factor in my weight loss. It does control my hunger, but it also controls my insulin intake. Insulin is a growth hormone, so it automatically, it causes you to gain weight, but being on the Tirzepatide has decreased my intake of it, meaning that I don't need as much insulin as I used to. So that does help control my blood sugars, and it does help control how much insulin I have to give myself between meals and during meals. The most improvement that I've seen on the Tirzepatide obviously is the weight loss. I'm at about a 50-pound weight loss now. Aside from that, I feel really energetic. Going to the gym now is not a drag. It's more like I'm energetic enough to be there and want to stay there. And also my sleep has been better. For whatever reason, I'm able to rest more than I was able to before. I used to have like night sweats, believe it or not. Those have stopped. I used to have really bad back pain, which I'm guessing might have been because of the weight. But since I've, dropped the weight, my back pain has decreased so much. I think that Tirzepatide is not just a diabetic thing, and I do think that people who are trying to at least get a jump start, especially, people with diabetes, it's hard. It's really hard to manage. It's a good jump start. The key to it is it's not an easy fix. Once you start taking it cool, the weight drops, but then you need to make sure that you maintain your weight by working out and eating better and drinking your water and absolutely increasing your protein. I definitely have learned that. I think it's beneficial to anyone who's trying to get on the weight loss journey and that needs a little bit of help, but the key is to maintain it outside of just being on the Tirzepatide. For anyone that's wanting to check Madison Medical out, I obviously did my research, but also the people. To me, it's a judgment-free zone. To me, you can ask questions. I always stress that with anything that I do. It's okay to ask questions. It's okay to be concerned, but it's also okay to, let people in, especially if being overweight or anything like that. It can be embarrassing. It could be, where you don't really want to talk about your insecurities, but I just feel like being here at Madison Medical, you can express anything, and everyone has always had the most delightful attitude towards me since I've been coming here.